What's up, you guys? Hey, it's Dr. Buck, and in this video I am going to watch and comment on New Amsterdam, a new medical show. So a lot of you guys have been asking me, can you watch like Grey's Anatomy? Is it real? Blah, blah, blah. There's just a new medical show, New Amsterdam, just a couple episodes right now. So I'll watch that, comment, and we'll see if this is some real shit here or it's a bunch of Hollywood fluff. All right, so here we go.
Que transformó esa clínica.
Sí, por corriendo todos, hasta las enfermeras. Ay, no te preocupes, chica.
This is true. The nurses and environmental, services people always talk shit on doctors. This is very true.
Voy a organizar reuniones semanales con las enfermeras y los conserjes para que seas tu trabajo más satisfactorio, eficiente y sin...
They're fucked. He's definitely firing them.
Wait,
What?
did you hear that?
Hear what?
So lips are blue. She's having some wheezing, or sounds like stridor. Possibly. I think what they're trying to do is say patient has stridor. Stridor is an indication that the vocal cords are too close together, which means you can't get enough air in. So stridor is sometimes an airway emergency. So in this case, you need to intubate the patient. You give them some like steroids, racemic epi, and intubate them and possibly crike. This is where I come in. I've had a couple of these where they're vocal cords collapse for different reasons, or it could get too swollen. And if you do a cricothyroidotomy, which is you've seen like in the movies where they stick a pen in someone's neck, that's a cric, but you do it like in a better way in the hospital.
No pulse, no BP, cyanotic rigor mortis.
I need a deep ventilator, ALS, resuscitation team, now.
That's impossible. She's dead.
Well, at least you didn't kill her twice.
If somebody's dead, leave them dead, okay? Don't go and resuscitate them. You know why? Because their brain is dead. You can resuscitate the shit out of the body all the time. You can bring the heart back, get circulation back. That's not a problem. Problem is the brain has been dead. So if the brain hasn't been getting any oxygen for a little while, then the brain's dead. You bring the patient back, and now they're a fucking vegetable. Okay? Turn water feed is what we say. So you put them by the window, you give them water, and you give them food, but they're not going to do anything. So
Patients don't need insurance.
Dora, I know the history.
The dean makes me tell it to every new medical director.
And how many of those have you worked with?
5 in 5 years.
he can't be the new medical director of this huge hospital. It's like he has no gray hair. That's a requirement. You have to have gray hair to be a medical director because that shows that you've done some shit.
I'll tell you what, I'll continue giving speeches all over the world because you can't afford the kind of publicity I give this hospital. And I'll continue my on-air appearances with Ellen, Oprah, and anyone else powerful enough to go by one name because someone has to remind New York that even though New Amsterdam is an underfunded public hospital, we can still go toe-to-toe with the privates from basic care to state-of-the-art procedures. I will be back next week. We'll lunch at the tavern. My treat.
Hot shot doctor who thinks she's a fucking movie star. I don't know any of those. On his coat, it only says his name and MD. I'd be offended. I want everybody to know what department I'm in, specifically surgery, because that way they know I'm better than them.
Sorry.
No, have you had any time to think?
It's time.
This is typical. You're trying to have a conversation with somebody and get interrupted. It's like happens like every fucking conversation all day long.
Sorry.
Butt in the face. Early morning lecture, butt in the face, people sleeping. Classic. Oh, this is a introduction of this dude. He does look a little tired, so that I will give him.
How can I help?
That's a good line. Remember that. How can I help? You're gonna use that a lot.
That's not a trick.
Question, I'm really just asking. How can I help? Shout it out.
Get some real fucking doctor shoes.
Yeah.
Hi, Dr. Iggy Fromm, head of psych. Can we do something about healthy food?
What do you want to do about it?
Oh my God.
Have some.
Healthy food. This is my pet peeve about hospitals. It's like you're in a healthcare system and you're feeding people fried chicken and fucking Jello, the patients and everybody else obviously, and nobody, like hardly any hospital systems have like actually healthy food. It just drives me absolutely insane. I don't know why that is. I can never, like when I go to the hospital, like I eat well at home and then when I go to the hospital I look at shit. I have a bunch of junk. I fired all the surgeons, all the cardiac surgeons. Who's gonna have the fucking swagger in the hospital? You gotta have some swagger in the hospital. Oh, this kid is bringing something to the hospital. It's gonna be a disaster. Fevers from Africa. Bad virus.
How long have you noticed irritation?
Do you think she's coming back early?
Max,
Yeah, 4 weeks, 6, maybe 8. I don't know. You look tired. Do you need a nap?
I need you to stay still.
Mm.
Good luck with that.
All right. Who calling?
Dean of Medicine, third time.
Ignore.
Max, please stop talking.
So doctors are like the worst patients, we don't ever we never want to go in and see anybody because, we see such bad shit happen all the time. And so we think you can get sucked into the medical industrial complex is what I call it, right? So it's just like a lot of people will show up and they'll say, oh, well, I have a cough or cold. And then they come in and find out they have cancer and they're like, I was fine at home. And that's what I call like getting sucked in. But it's really not getting sucked in. It's just like a lot of people don't have the understanding that they weren't healthy before, and now that they get actually somebody to look at them, someone's like, oh my God, there's a lot of problems here, and you start digging, and then lots of problems become a shit ton of problems, and so doctors never want to get sucked into that, so we're just like, I think I'm just gonna ignore it instead. I hurt my back one time. One of the neurosurgeons I talked to, I'm like, dude, I hurt my back, and it's really bad. It's been going on for a really long time, and he goes, well, there's a couple things we could do. He's like, if you're somebody that wants to know what's going on, then we can get you an MRI, or we can just get your steroid pack. And I was like, I am not somebody that wants to know what's going on. Just help my symptoms. And he's like, all right, I'll give you a steroid pack. And then it kind of went away after a while. So I still got that every once in a while.
Maybe you shouldn't have fired the entire department.
They were all corrupt and lazy.
See?
Basically, that would never happen. You cannot fire all of the cardiac surgeons in a hospital. That is stupid. They make a lot of money for the hospital, which is why they often walk around with a lot of swagger. The hospitals have to be able to take care of certain emergencies, and if they're designated as cardiac center and stuff, or especially for cardiac casts, patients will get stents and stuff like that. And if they get a stent, or if they go get an angiogram and they're found out to have 3-vessel disease and they have to have cardiac surgery and it's an urgent or emergent kind of thing, then you can't really just not have the fucking surgeons there.
Lady, it is way too early in my day to call security, but I will.
Dr. Froome! Dr. Froome! Dr. Froome! Dr. Froome! Dr. Froome! Dr. Froome!
Okay, I got it, Gemma. Hi. Hey, I got this.
Psych ward is fun.
Floyd Reynolds?
Okay, I'll have to say another thing about this dude. I don't like that he has the coat open. I like to close the coat, 2 buttons up top at least, not 3, usually just 2. I don't like to keep, it looks sloppy, And plus he's a medical director, he has scrubs on all the time. Why is that? He should have a suit. He'd look better and shaven and stuff. People always give me shit about because I didn't shave all the way when I was in residency, and now either I shave or I have a beard, but not in between, because it just looks sloppy, and who the hell wants a sloppy person taking care of their body?
Because I don't intend to pat you on the back, given the appalling history of patient care in your department.
If I were you and I analyzed our performance, I would have done the same.
By performance, do you mean the highest mortality and infection rates in New York City? Because that's like the Beyonce of performances, if Beyonce, killed people.
So here's another issue here, is that he's the highest mortality and infection rates in the city. That could or could not be related to the surgeons. You don't know that. And actually, I met a guy who does that specific thing. He goes into hospitals and tries to find exactly where infections are coming from, because certain hospitals they'll have breakouts of certain infections, and they sometimes can't track it. And for instance, I was talking to this guy, and he said that one time he found that the infection was coming from the laundry, because somebody was trying to take a shortcut and they were dumping the laundry out on the pavement outside of the hospital, and then it was coming back in for some reason, and there was some trash out there, and that trash picked up this specific bacteria, brought it into the laundry, and then it didn't get killed in the laundry, and then it went around the entire hospital and gave everyone this infection. So just because patients have an infection doesn't mean it's actually the surgeon, because there's obviously a lot of people taking care of the patient. But I will say that patients that have a longer operation, so if your operation time is longer, then you can have a higher infection rate. And then mortality in cardiothoracic operations are generally, most of the time due to the surgeon. But you also have to compare your patients to the rest of the patients that you're comparing to. You can't just say oh, our hospital has a higher mortality, because our hospital might have more problem patients or very diseased patients, and so that's it's not quite cut and dry like that.
Read your files. You have the lowest billing rates in the department. What's wrong? You don't like surgery?
I love surgery.
Then why did you perform half as many procedures as your colleagues?
Because my patients didn't need them. Because there's other ways to help people than by cutting them open.
So this is something we get into a lot, is that this is professionalism. this is an interesting point because, as a surgeon, some people get paid to operate, and some people get paid just to be there per day and actually do both at the current time. How do you know somebody is just not operating because they want to get paid? And that is professionalism. You're hoping that all of your surgeons, obviously, and all of your healthcare providers are professional enough to say, you don't need surgery, even though I'm a surgeon and I get paid for it. So that's a little bit of a conflict of interest, which is interesting. I've gone to some meetings of like administrative meetings, and they'd say, oh, well, you can't be in this meeting or whatever because this is a conflict of interest. I'm like, we have conflict of interest every single fucking day as a surgeon. Like, what are you talking about? And I actually said that at a meeting one time. I didn't say the fuck part, but they were like, yeah, I guess we do. I'm like, yeah, we do, duh. It can happen, and it's certainly hard to kind of determine, but if you can't dig into the numbers, and that's what it takes to find out like which patients are getting surgeries and if they really need them based on their, in this case it would be based on their angiograms probably.
I've been practicing here for 25 years. The key to survival is to have more than one speed.
I can go faster.
That's not what I meant.
Just keep me in the loop on this, will you?
The key to survival is to have more than one speed. You need to get this motherfucker out of the hospital because his speed is slow and very slow. I'm gonna tell you right now, not to offend anybody, and I probably will offend some people, but this is like government workers, right? Don't do too much work because then like you're gonna have to do more work later. And this is what happens in the VA system, unfortunately.
It appears Patricia's brain convinced her heart that she was dead, even though she was very much alive.
Now this is pretty interesting. He said the brain convinced the heart that she was dead, even though she was very much alive, right? That's what he said. So that's an interesting concept because a lot of patients that we see manifest physical signs and symptoms based on their psychological issues. And so like anxiety is actually a really common one. People get super anxious and they get chest pain and they hyperventilate and they think they're gonna have a heart attack because they actually have chest pain, but it's not from a cardiac source, it's from up here. This is what we call supratentorial. A lot of times you'll see surgeons and say, the ER doctor's like, what do you think? What do you think about the belly pain, blah, blah, blah. The surgeon will say, I think this is supratentorial pain. Sorry, so the tentorium is the thing that separates the low brain from the high brain, basically, okay? So supratentorial is like, it's all in the head. Here's this kid about to infect the entire hospital with Ebola. I don't really do a lot of infectious disease, but...
We have a patient in the ED from Liberia presenting with all the signs of malaria, Lassa fever, TB, or...
Ebola.
Oh, Ebola! Shit, I'm good! Not that good.
Everyone interacting with the patient is required to wear personal protective equipment at all times, no shortcuts, ever.
Personal protective equipment, also known as PPE, drives you nuts. Not with Ebola, because obviously it's dangerous, but there's a lot of bacteria in the hospital, and let me put it this way, there's a lot of bacteria that are naturally on our skin, and we're carriers of bacteria, and MRSA is one of them, methicillin-resistant Staph aureus. And a lot of hospitals make you put all this gown and glove and mask on for that, even though everybody's carriers, but then the nurse, most of the hospital staff are carriers of that, but we don't have to have our PPE on when we interact. It's stupid. Anyway, PPE is a trigger word for me. I've never dealt with any
Test results
this bad infectious disease. However,
48 hours.
I will tell you that this chick just took a biopsy of his throat, and now she's in doing infectious disease something. So that doesn't really make any sense. If it was for real Ebola and they were really concerned about that, probably this person would not be doing it. It would be a infectious disease physician or specialized agent.
Your husband said you were taking haloperidol.
For 2 years. For depression.
So she was taking haloperidol, and this is actually what happened. She had a tardive dyskinesia, which is when you lock up. I think that's what happened. She was taking too much Haldol.
Well, she's in pain, and she's not getting any better.
This is what drives me absolutely motherfucking crazy, is that when patient's family or the patient is like, well, I'm in pain. You have to do something. Bitch, we are doing shit. Like, just because you're in pain doesn't mean we're not doing something. Secondly, we can't take everyone's pain completely away. If we did, you would be dead. You understand? There's lots of different types of pain. You're being a pain in my ass right now, is what I said. And sometimes patients are just fucked up and there ain't nothing to do for them.
A patient from Rikers was admitted with 17 lacs, ruptured spleen, aortic tear. We got him stable in the ED, but care's all you.
So that was a good one. She said patient, I think she said MVA, spleen and aortic tear. So that is a aortic transection and probably a splenic injury. So this is an interesting topic because it used to be that these patients had to have an operation, and if they had to have an operation on the aorta, which is a big blood vessel, usually you have to give blood thinner. But because the patient has a splenic injury, then if you give blood thinner, then the spleen is probably going to bleed, and then you have to take that spleen out, or they're going to hemorrhage to death. So this is a tricky situation. Except now we have stents, and a lot of these aortic tears can be stent can be placed inside the blood vessel, because the blood vessel is big. The aorta is like this big. So you can put a stent in the blood vessel and cover that, basically the tear. But the treatment for that would be first stabilize the patient, take the spleen out if you need to take the spleen out, but also keep the blood pressure low, because the higher the blood pressure goes, the more pressure on that tear and the more chance then the aorta will rupture. And those patients actually have 50% survive to the hospital. 50% of those patients actually die in the hospital, so no joke.
Wait, you're not trying to...
Look, Lauren, I think you're great.
Oh, wow, you are trying to.
I guess I'd rather us just be friends again, you know?
Oh, I think there's a little romance there between the surgeon and the, I'm not sure who she is right yet. She's either an ENT or an infectious disease doctor.
Why not see where this goes?
Okay, here's the other question I get a lot. Do you have relationships in the hospital? Of course you have relationships in the hospital. You're around people a lot. The people you have relationships with are the people that you're around a lot. Except now that we have Tinder and Instagram, then it's all fucked up. But in the old days, you had like relationships with people in the hospital, and that would be including nursing, environmental services, right? The medical staff, administrative staff. It's a little bit of a jungle out there, let's put it that way.
You'll get it back in the morning.
It's mine.
Gemma, give me the journal. Gemma, don't do this. Gemma, please.
Oh, not a good way to start the day. Fighting with students.
Can I ask why you pushed?
So the medical director would not be dealing with a psych patient just because they had a little fight. That just doesn't really happen like that, unless he's a psychiatrist as well as an infectious disease doctor and a surgeon.
Dr. Kapoor's patient in 1208, he wants to be kept in the loop.
Yes, thank you. How's she doing?
I think Dr. Kapoor is going to kill her.
I love that. I have actually done this before. Had to go to another attending when I was in residency and be like, you have to stop Dr. So-and-so. They're gonna kill him. And then the attending was like in an operation. I like run in there. I'm like, I didn't run in, but I was like, I go in, I'm like, Dr. So-and-so, you have got to listen to me. And she was doing an operation. She was like super awesome. She was one of the attendings I really loved, and I trusted her a lot. So like, so-and-so's gonna kill this patient. And I gave her the scenario, and she's like, okay, I'll be right there. And she's like, after finished the operation, went to the bedside and fixed everything. And I was like, oh man.
They claim they sent one of their followers from Liberia to New York City, infected with the Ebola virus. Your patient is now a terror suspect.
Look on his face, like, how more could I get today? Can't say I've ever had the Secret Service come, but actually I take that back. I had a patient that was like a senator, not a senator, governor, and we had, I guess I had Secret Service with that one.
So much death here. Got to you, didn't it?
No, actually, I became immune to it, which is even worse.
Oftentimes, you get immune as a physician, especially a surgeon, to death, unfortunately. I get accused of not being very empathetic a lot, but the thing is like, here's the deal. if you're dealing with, life and death situations on a daily basis, then you are not very empathetic to, like, say, a hangnail, right? So that's where things get confused, because when people, especially patients, think that they have a serious problem, but they don't, they want you to, like, be like, oh my goodness, like, oh, we have to, I'm so sorry, we're gonna fix this law, and rush to their side, which you're like, listen, you're not an emergency, you're nothing, and then, like, I have, like, 5 other people that are about to die right here, so, like, I'm not impressed with you, that's where it becomes, like, a problem.
You need to slow down.
Yeah. Get that a lot.
You have cancer. Squamous cell carcinoma.
She's talking about, like, squamous cell carcinoma like it's a death sentence, and it is not. It is a highly treatable disease, depending on where it is and how much it invades through the layers. It's very treatable. So tell him this guy, like, acting like the cancer is about to ruin his life and he's gonna die in 2 weeks is kind of a little dramatic.
How can I help?
Uh-oh, he has a baby? All right, that's not bad. I would give it a solid 6.5 out of 10. No, I think it's actually not too bad. It's there wasn't a ton of, like, emergency or surgery or anything like that in there where I could say what they're doing wrong. But I mean, they're all like this. Like, all the shows are kind of, you have to have one doctor do multiple things, otherwise, like, you have to have too many people and all that stuff. You have to have that character, like, do cool stuff. So I understand that. So I'll probably watch it again. I think I'll watch the episode 2. All right, you guys. Hey, thanks for watching another video. You guys are awesome. Subscribe, share, like, and comment below if you think this is a good show as well. All right, take care.